Now, yesterday, we talked about why dentists aren't having the success that they want, despite pouring tens of thousands of dollars into getting page one rankings, Facebook likes, and page views. Now, today, I want to look at what dentists are going to do to make their phones ring. Stick around. It's Wednesday, May 13th, and I want to take you through a look through the third day of the Look at My Townie presentation on systems-based patient attraction. Now, if you're like most dentists, you think the way to attract more and better patients is about telling them why you're the best. You want to obviously capitalize on the fact that you've got more continuing education, more training, better equipment, and more cool toys than your competitor. And what you really have is a big wee-wee problem. You've built your website and other marketing around what we can do, and we're better because, and we offer this because, or we offer that, or we are the dentist of choice. You spend 80% of your space and time talking about yourself, and 20% of the time, or less, talking about your patient and your patient's perceived problems. The fact is, the ratio should be truly reversed. You should be marketing to your patient's perceived problems 80% of the time. If you want your marketing message to resonate with your patients, you've got to speak their language. And you need to enter the conversation that's already happening in that patient's mind. For instance, if you want to market dental implants, it's a really great idea to focus on the procedure, the implants themselves. Do you think a patient that wants to get implants thinks about you drilling into their jaw and screwing in a titanium implant and putting the abutment and crown on top of it? Does that sound appealing? If you had a heart attack and you walked into your cardiologist and he said, man, we're going to run this catheter and we're going to do this, and this is the brand of the catheter and this is the brand of the stent, or the type of sutures we're going to use to do the bypass surgery, would you be impressed, or would you be concerned he's more worried about what he does and not about saving your life? Talk about how your patients can eat the foods they love again. Talk about how your patients can stop wearing dentures that irritate their gums. Most dental marketing that I look at is not focused on the problems, and it's more attuned to attracting other dentists than it is patients. I don't think many of the patients in your practice are other dentists. Now, think of it this way in another context. Plumbing explodes in your office. Water's pouring out of the ceiling, and you call Joe Plumber. And you say, Joe, you got to come out here and fix this. And Joe says, okay, should I bring a PVC or a PEX or an NPT? Or what kind of pipe fitting should I bring out to fix it? I don't know about you, but I'd hang up on Joe and call another plumber because I don't know anything about plumbing. I don't want to know anything about plumbing. I just want my problem to go away. I want him to come fix the water that's pouring out into my office. That's how your patients feel about their mouth. They've got a problem. They want you to fix it. The big three questions that patients want answered are, will it hurt? How much is it going to cost? And is it done right? Patients want a dentist that they can know, like, and trust. Dentistry is a very trust-based profession. And once you get somebody to like you, that's 80% of the battle. Everybody does business with people they like. Very few people would I let hold my wallet. So building trust with people is paramount. How do you build trust with somebody? Well, come back tomorrow. I want to tell you how the way people build trust and engage with your practice has changed in the last decade. Until then, keep moving forward.